Rabbit syndrome is a movement disorder and is characterised by involuntary vertical rhythmic movements of the lips and mouth. The tongue is not involved. The disorder is an extra pyramidal side effect of the first generation or typical antipsychotics, such as haloperidol. It usually occurs in patients who have been on the medication for years. However, it is known to occur in some patients who have been on the medication for as short a time as a week. Rabbit syndrome has been reported to occur in patients taking atypical antipsychotics or second-generation antipsychotics, such as risperidone, olanzapine, clozapine, and aripiprazole. Rabbit syndrome can be misdiagnosed as tardive dyskinesia, which is another movement disorder that is caused by typical antipsychotics. However, in tardive dyskinesia, unlike rabbit syndrome, the tongue is involved. The movements do not occur just vertically, and the movements in tardive dyskinesia occur more slowly and less rhythmically than in rabbit syndrome. The movements in rabbit syndrome are more like a fine tremor, but those of tardive dyskinesia are more like lip smacking and chewing movements. Another difference is that movements may be voluntarily stopped in patients who have got tardive dyskinesia, but in rabbit syndrome they cannot. It is totally involuntary. We do not have a good understanding of the neuropathology of rabbit syndrome. However, there are different ways of treating it. For example, the typical antipsychotic medication dose may be reduced. The typical medication may be swapped for an atypical drug, and anticholinergic medication may be used to treat the movement disorder, such as recyclidine.